My name is Dr. Yambay, and I am an endocrinologist, and I see patients with diabetes all the time in my clinic. So today we're going to talk a little bit about what is diabetes. So diabetes is a chronic condition, which means that it's a disease that manifests itself over time and it doesn't really go away. Once you have it, you don't get rid of it, but you can deal with it. So what is diabetes? Diabetes is just when your body cannot process the blood sugars well, and because the insulin that your body makes is not sufficient or does not work very well, so then you have problems with elevated blood sugars and the symptoms that come along with that. How do you diagnose this? With a test, with a blood test, or with a couple of blood tests actually, and they need to be repeated to confirm the diagnosis. Why is it important? Because diabetes is an epidemic actually. It's a disease that affects a lot of people. 27 million Americans have diabetes, which is 8% of the population. And to make matters worse, about 80 million people actually have underdiagnosed or pre-diabetes, which is an alarming number. So what are the risk factors for those who are more prone to have diabetes? So number one is, age. Anybody who's above 45 years of age can have diabetes just because of age. And should be probably tested routinely. People who have a strong family history of diabetes are more likely to have it. Females who've had a diagnosis of gestational diabetes or who gave birth to babies that are large, over 9 pounds, are more likely to have diabetes. People who are very sedentary, who don't exercise very regularly, and who are obese or overweight are more likely to have this. People who actually have high blood pressure or problems with their cholesterol, especially the triglycerides and the having elevated triglycerides or low HDL, which is the good cholesterol. Those are the people that are more prone. And certain ethnic groups are also more likely to have diabetes, and they're the Hispanic, the African Americans, the Asian American, the Pacific Islander, and the Native Americans. And obviously those who have a diagnosis of prediabetes, which includes impaired fasting glucose or impaired glucose tolerance. If you hear these terms from your doctor, they will always refer it to as prediabetes. So once you have that, you're more prone as well. Because it can have a lot of consequences if it's left untreated for many years. And there are a lot of complications that can happen, and they include strokes, heart attacks, blindness from eye involvement, kidney failure and dialysis, nerve problems, nerve and circulation problems that can cause nerve pain or loss of sensation with open sores and wounds that don't heal, and then these can lead to amputation. So it's very important that if you have symptoms of diabetes that you actually see your doctor to help make the diagnosis. To summarize, basically diabetes is just a disease that involves the body's poor utilization of blood sugars as an energy source, and it needs to be treated with either healthy choices of lifestyle modifications or medications, and needs regular visits with the doctors to review blood sugar readings and to see how the medication is actually working to help control the blood sugar levels.